Hello, and well, there's no one, but where is your book? Okay, where is this paper? Hello, Juan. Juan asked, how can I take advantage of the information that is in the Facebook group in in respect of applying to internal medicine, and if there is any benefit of trying to set out your position as a Spanish speaking person or as a person from Latin America. And Juan, if you're there, yes, there is value on mentioning that you are from a Spanish speaking country, especially if the area that you're applying to has a dense Spanish speaking population. Not only because you will speak Spanish in as a native speaker, but you will also understand the cultural aspect, and it will seemingly be easier for you to reach these patients. These patients will identify with you. And how can you take advantage of the information on the website? Well, the website is meant to to help applicants to know what is there to say, or how is the to give a very meaningful answer for an application on primary care. Remember, primary care is internal medicine, family medicine, and pediatrics. Even general surgery is primary care. So um, it's different if you answer a question from the perspective of you being aware that your presence or your application or the reason why you want to apply to primary care in the United States is motivated by your understanding of the culture, or your understanding of the language they speak, or the barriers to health that these immigrants experience, because you yourself come from a country that is limited in access to care. So um, when you look at the videos that we have, I'm mainly telling you, hey, use this information. Try to see if in your career, in your years as a student, you face a patient like this, or you face a situation like this. Now use that, put that experience in perspective, and when the question comes to you of tell me about an interesting case, then you don't talk about I don't know, a very difficult cardiac or pulmonary case, but you talk about a patient that had difficulty understanding his diagnosis of hypertension, and you helped because you're an empathetic person, or because you are able to connect to another person in a very simple level. So that I think that's the value of the website, giving you a different perspective on how to approach the interview season. I believe it will make a difference. Hello. I was just typing back to Juan, who asked if what the purpose of the Facebook group that we have, the Residency Match Insiders, and the purpose of this website is just, or this Facebook group is just for you guys to have that little extra perspective that when a program director hears from you, he will be like, "Oh wow, this guy is coming from Peru, and he already knows about social determinants of health, or he knows about hospice. So let's get this guy. Let's not get the other guys that don't know anything about life and just talk about I don't know prefabricated answers for things that are not important in primary care." So the counter question is so it is better to get to the interviews. um, entonces es mejor llegar a las entrevistas desde el punto como una puedo mejorar el aspecto de comunicación y mejorar la relación médico-paciente. Mi pregunta es debido al alto enfoque en la investigación. No entiendo la pregunta muy bien. Tú estás muy enfocado en la investigación. Um, ¿Cómo puedo mejorar el aspecto médico-paciente? Tienes que preguntarme de nuevo porque no entiendo bien tu pregunta. Tu interés es alto o grande en investigación, parece. Espero que me mandes la pregunta y te la respondo si es que puedo. Dice, sí. O sea, en programas universitarios veo más un enfoque a investigar que las determinaciones de salud que puedan ayudar a que una persona latina pueda ayudar, o estás equivocado. Estás equivocado, estás equivocado. Um, los programas universitarios no es que solamente hagan investigación. Por ejemplo, UCLA. UCLA, the University of California, Los Angeles, it's a university program, puramente universitario, ¿cierto? Es uno de los mejores. Y a ellos les gusta, tienen mucho interés en la investigación. Pero cuando abren los programas de medicina interna, te mandan a un hospital donde te van a poner a trabajar durísimo y no tienes ni siquiera tiempo para investigación, pero esperan que hagas investigación. Pero no pienses que porque vas a estar en un programa universitario, lo único que vas a hacer es investigación o es un enfoque grande de investigación, no. Pero lo que sí es importante saber es que programas universitarios son muy estrictos en cuanto a, ¿cómo se dice? Evidence-based medicine. Que cuando tú tengas un caso, cuando presentes un caso, siempre menciones de dónde has sacado esto, cuál es la evidencia. Cuando estés tratando a un paciente o cuando hagas documentación, tu documentación tiene que ser a un alto nivel en el cual digas, por ejemplo, voy a usar vancomicina porque la evidencia o los estudios en casos de infective endocarditis suggest that long-term treatment with vancomycin is more effective than short-term clindamycin. Hay muchas oportunidades para hacer investigación en programas universitarios, sí, pero no se descuida la parte que es interactuar con los pacientes. Entonces, lo otro que tienes que saber es que estos programas universitarios usualmente están a cargo, están dirigidos o están tratando de tomar hospitales que tienen alta cantidad de pacientes pobres. Entonces, hay mucha necesidad de demostrar que tú entiendes cuál es la relación médico-paciente. Sí, Juan, no hay problema. Pero sí, no te olvides de esa parte. En todos los programas necesitan que sepas mucho de la relación médico-paciente, de qué es lo que está pasando en medicina en estos días. Por ejemplo, hoy día voy a preparar un video acerca de cómo saber cuándo un paciente va a hospice, por ejemplo. Y no creo que muchos en países de Latinoamérica sepan cómo es aquí en Estados Unidos, pero sirve bastante. ¿Por qué? Porque programas de primary care como internal medicine, family practice, have a need to treat inpatient and outpatient, but there's also a need to see or to offer an alternative of treatment, which is not necessarily medications, surgeries, treatments, but for example, hospice. Maybe this patient that you want to treat with chemotherapy doesn't want chemotherapy. He wants to just be at home and chill with his family. So hospice comes into place. But everyone has to understand that not every patient can go into hospice just because they want to stay at home. There are rules to follow, or there are rules to demonstrate when you want to call hospice. For example, you're doing a rotation and you say, I want to send this patient hospice, and this patient is not appropriate for hospice, then might be a negative intervention for you. But that is what I make these videos, because I do believe that a lot of students will benefit of having this information. So when you apply or you're doing your first year, or even a simple rotation, you can say, hey, I think that this patient should go into hospice because X, Y, and Z. And so I will keep trying to do this on some days when I'm free and not doing much. I will keep trying to do this of getting online and just being here to answer some questions. Um, Certainly, with the interview season about to start, it's getting more and more busy for me. But yeah, why not? 1 hour once a month or every 2 weeks. I think that should do. But I do think, guys, you have to prepare. You have to try to read as much about primary care before going into this interview, because it's not just about saying hi and saying I come from Peru and I want to be an internal medicine doctor. No, there's more meat that you have to give to demonstrate that you are the person that they want there, the person that is hardworking, not just by saying hardworking, but by giving examples on how you did it. And that's I believe that that's the part that will differentiate or make a difference between you and the thousands of thousands that will apply the same year. So yeah, stay tuned and watch the videos, ask me questions. I really have a very relaxed schedule. As a hospitalist, I don't do heavy work, so I'm pretty open. Um, we'll see how it goes, because I'm getting a lot of requests to do one-to-one sessions. So on my weeks off, I have like some days that are scheduled for that, and some days to spend with the family. But I think this is something I could do once a week, and I think it helps. And you guys will tell me. Yeah. Um, in After I finish this at minute 30, I'm gonna start doing the video for hospice, and I will try to take pictures of this little booklet I have on hospice, and paste it on the Facebook group. But the video will be on YouTube, and you will see. It's once you get the idea. I think there's different ways how you can use this information that you will learn today. But since you're here, I'm gonna give you some ideas so we can use the 7 minutes. So hospice here, um, I used to do hospice. I used to work in a hospice agency, and it was one of my side gigs. I would get paid to treat those patients, and it is easy work, but it's very demanding in terms of emotional drainage. It's very consuming because you get to talk to a family that knows that the patient is dying, and there's not much you can do. Just talk about the medications that you're using. We use a lot of morphine. We use a lot of oral Ativan or diazepam, sublingual diazepam, oral morphine, morphine not in tablets, but morphine in drops. We use drops that you put 3 drops of morphine is equals 10 milligrams of morphine IV, and the patient is out. And so because it's out, he sleeps more, and the patient dies. So if you think about that, by giving all these pain medications, all these sedatives, you may be killing the patient, but it's not that. The idea is that if a patient that is in terminal illness is having pain, you have to give them something to relieve their pain, knowing that even by doing that, you can accelerate the death process. And in hospice, there is an active phase of dying, and there is a not active phase of dying. So I will talk more about that, but yes, it is very important for you to know about this. Just wait for the video. It will be a 20 minutes video, and you get some good pointers there. You know, in United States, hospice is it's a service that is paid under the all the insurances. All the insurances pay for hospice, and therefore, because it's a paid service, it can be abused. There are there are hospice companies that put any patient on hospice, and that's not the purpose of hospice. Hospice is not for a patient to have extra help at home, but it is for patients to have a doctor and a group of people supervising the disease, the dying process. And I say that because you could read on the internet, if you can Google all the problems with the legal problems of hospice companies in the United States, is that any hospice company can put a patient on hospice and charge the state for that service, and doesn't make it right. And many companies get in trouble. Doctors go to jail for doing this if they don't demonstrate that a patient is really um, appropriate for hospice. So yeah, those documentation for hospice is very important, and not everyone goes to hospice. Not everyone that is dying goes to hospice, but there are some diseases that qualifies for hospice. There's some demonstration of loss of function that qualifies you for hospice, and just going through this little booklet, hopefully I can get you good information. Okay, so I will do this next week. I will probably post on Facebook that I will do it, and hopefully can have more people. But it's good. It's good to have at least one or two and see that there is some interest on getting some answers. Good luck to you. Good luck to your friends, and if you can tell them to join the group and get into the Facebook, the YouTube group, that would be great. And well, that's it for today, and it was nice to meet you, Juan. Bye.